My name is Dr. Michelle Korn. I'm a board-certified pediatrician currently working in the United States on a visit here to Rwanda. Today I would like to discuss some techniques about breastfeeding and the importance of breastfeeding for your newborn baby. So one of the most important things about breastfeeding is the nutrition that you provide for the baby. In terms of what it does for the mother though, there's also benefits for you. A couple of the benefits I'd like to talk about. Number one is bonding with the baby. Breastfeeding allows you to be in close contact with your child, as well as it also gives the mother health benefits. Breastfeeding burns a lot of calories, so after you've had a baby and you have a little bit of weight to lose to get back to your normal state, this helps expedite that process. Breastfeeding is also cost effective, and you don't have to remember to bring things with you when you leave your home. You have everything you need with you and with your own body. In terms of what it does for the baby, there are also a lot of benefits. Again, bonding is a significant benefit for the child to be close to the mother. Also, there's a lot of nutrients in breast milk. While formula is a good alternative, breast milk by far is best because it offers many vitamins and nutrients. Another significant thing that it does for the baby is it provides antibodies. So what that means is that you give antibodies to the baby through your breast milk, which help develop the baby's immune system, which will help the baby fight off infection. Babies develop an immune system over the first 6, 8, a year, even 2 years of their life. So by breastfeeding, you're giving them a boost of the immune system because they get what you have to fight infections up to 6 months. So this is a very important thing, especially when babies aren't vaccinated right away. This helps confer immunity that they wouldn't normally have. Another thing that it does is babies' digestive systems have to develop. As adults, we have bacteria that live in our bellies that are normal and healthy. When babies are born, they don't have that. So by breastfeeding, you're helping the baby's gut, the baby's intestines, to develop this ability to digest and fight infections in the gut as well. So those are some really important things. And most of all, the baby gets all the nutrition that the mother gets in her body that then transfers into the breast milk, and then the baby gets full nutrition from breast milk. One of the other important things about breast milk is that it's easier for a newborn baby to digest. It's very rare that a baby has an allergy to mother's breast milk versus things like formula that can sometimes cause some discomfort just because of the immaturity of the baby. So a few of the other benefits of breastfeeding is brain development. Because the nutrition of breast milk is so good, the brain development helps. And this is also very important in, say, preterm babies who are born a little bit early. It's very important that they get the correct nutrition, which again, breast milk is a complete nutrition. So this is also good for brain development, developing milestones, being able to learn how to have muscle control, head control, smiling, talking, all of these things that we want children to develop over the first few months that are very important. The only thing that's missing in breast milk that's really important to mention is vitamin D. Vitamin D is an important vitamin that you can get from sunshine and also from the diet. But in breast milk, there is no vitamin D. So if you are to choose to breastfeed your baby exclusively, meaning no other nutritional supplementation, it is important to talk to your doctor about providing vitamin D because this helps your body, the baby's body, to be able to have good calcium, which helps bones develop and create strong bodies for babies to then learn how to walk, lift objects, things like that. So again, breast milk is very nutritious, but it is missing only vitamin D, but there are supplements as well as minimal and short duration of sunshine for babies is also important, not prolonged sun exposure because their skin is also very sensitive at birth. So one thing that's important to mention, since I've been talking about vitamin D, is this is something that needs to be given in solely fed breast milk, meaning you only are giving your baby breast milk. As your baby ages, let's say around 4 months, 5 months, 6 months old, when you start introducing other foods, then vitamin D will be given in those foods. So again, I just want to emphasize that vitamin D is really important if you're only feeding the baby breast milk, which is right when they're born, and usually up to the ages of around 4 to 6 months. But again, you should be working closely with your pediatrician so that they can evaluate your child based on every baby's individual needs. Talking about vitamin D, as a mother, even if you have normal amounts of vitamin D in your diet and you get regular sun exposure, the important thing is that it does not transfer into breast milk. So as a mother, you may have normal, healthy amounts of vitamin D, but that doesn't mean your baby will get the vitamin D in the breast milk. So that's another important thing to keep in mind. Why I'm mentioning vitamin D is because the baby doesn't get it from breast milk at all. It's the one thing that's missing in breast milk completely. So again, even if you have healthy stores in your own body as a breastfeeding mother, the baby won't get that. So one of the common questions that a lot of mothers have is if they should avoid certain foods while they're breastfeeding. Aside from, I would say, alcohol, which we recommend avoiding while you're breastfeeding in general, in terms of food, I recommend to mothers to not worry too much about it. It's important as a breastfeeding mother that you get a lot of nutrition because, again, breastfeeding burns a lot of calories and it takes a lot of work for your body to produce enough milk. So in terms of avoiding foods, there's really nothing you need to avoid. I would say, for example, sometimes women who eat things like beans, as you probably know, sometimes beans, when they digest, can make you a little bit bloated or gassy, and that can be a little bit uncomfortable. Sometimes in a baby who has mother who who eats beans, the baby then can have some of those same side effects. And since the baby's gastric development is still coming, meaning the bacteria is developing, they can feel really irritable because they don't know how to get the gas out and they're still learning how to go poop and how to have gas. So what I would say is that if you notice, hey, I ate beans today, for example, and I notice every time I eat that food, the baby has a hard time sleeping or seems to be more irritable, then you could leave that out and try it and see if the baby gets better. But in terms of there being certain foods you need to completely avoid, I would say if you feel good, most likely the baby doesn't have an issue. If you feel something after you eat really spicy food and you notice again maybe the baby's crying more or things like that, then maybe avoid the spicy food for a few days and see if that helps. But again, I think it's a very individual basis and there's really nothing that you need to avoid specifically in most cases. In babies, their digestive system, and when I say digestive system, I mean from the stomach to the small bowel, which is part of the digestive system, to your large bowel, which is the colon. So in your small bowel portion and in your large bowel, different things happen. In the small bowel portion, which is the portion right after your stomach, that's where you digest the food and your body takes all the nutrients. And then when you get to the large colon portion, that's where your body gets rid of all the toxins. And bacteria play an important role in both of those things. So in babies, I think like I mentioned earlier, one of the benefits of breastfeeding is that you're giving your baby specifically an antibody called IgA. That stands for immunoglobulin A. And that helps your baby have immunity to certain infections. But what breastfeeding does is it also helps what we call colonization of the gut. And that means it helps introduce normal, healthy bacteria into the gut, the small and large bowel, to help perform those normal functions of getting nutrition from milk and then getting rid of toxins, which then the baby excretes via stool. Bacteria are really important to help us learn how to digest food. So when you breastfeed your baby, you're helping to develop that system. Babies are born with a sterile gut. That means that they don't have the bacteria necessary to digest food healthily. So what you're doing when you're introducing breastfeeding, you're helping your baby develop the bacteria that is normal and healthy in the gut to help then learn how to digest food and ultimately to go to the bathroom to poop healthily, because all of that is a system that babies have to develop. So now that we've talked about the benefits of breastfeeding, let's talk a little bit about what it takes to breastfeed. One of the most important things that I want to emphasize is that a lot of times in today's society, we hear breastfeeding is very easy, it's very simple, but I want to just make sure that new moms understand that sometimes it can be very easy. Some babies learn how to latch quickly, but other times some babies, they need help and they need to learn. And also mothers, especially new mothers, need to learn how to breastfeed each child because not every child is the same. So I say that because I want women to understand that sometimes breastfeeding can be frustrating. You feel maybe you're not doing it right, but I assure you that you just need to learn and work with your baby and be patient with yourself. It's not as easy as we often think it should be. We both, baby and mother, have to learn and have to be patient and take the time to develop the skill of breastfeeding. So in terms of breastfeeding, it's wonderful to do right when the baby is born. If the baby is healthy and you can do skin to skin right away, babies usually they cannot see right when they're born, but their sense of smell is very, very strong. And so when you put them on the skin directly, they often can find the mother's nipple by sense of smell. And I think that's a really important thing and emphasize why skin to skin contact is so important, because your baby's sense of smell in the first, few weeks of life is very, very strong. So when you get ready to breastfeed, skin-to-skin contact is wonderful because the baby will also get body heat from you, the bonding that we talked about initially, but then also learning to latch right away after birth, if you can, helps the baby get the skill early on. So one of the most important things about breastfeeding is, there's two important things I should say. One of the most important things is the latch, which I'll discuss in a minute, and also the position of the mother. She needs to be comfortable. So I want to emphasize those two things. So first I'll discuss the latch. When I say latch, what I'm talking about is when the baby attaches to the mother's nipple. So there's a part around the nipple called the areola, and that's the dark circle that you'll notice on a woman's breast. And then the nipple is the protrusion of where the milk comes out. So a proper latch is when the baby's entire mouth adheres to the areola. So the nipple should be completely in the baby's mouth and tucked back into the throat. And this is because it helps avoid discomfort in the mother. Breastfeeding can be a little bit uncomfortable at first. It may feel a little bit odd, but it shouldn't be painful. So if it hurts to the point where you feel you cannot continue, that indicates that the latch may not be correct. So the best thing to do if you're in a severe amount of pain is to detach the baby from the nipple and try again, because a proper latch should be pretty comfortable. So again, the baby's mouth will be tucked up right next to the breast, and the baby's nose will also be very close to the mother's breast. One of the concerns that mothers often have with this positioning is that they worry the baby won't be able to breathe because the nostrils are pretty close up against the breast itself. But I assure you that the baby can breathe. Healthy babies that are breastfeeding, if they couldn't breathe, they would turn their head or they themselves would come off of the nipple, because you need to breathe in order to live. And that's a normal response for a healthy baby to do. So you don't have to worry that your baby, if they're breastfeeding, can't breathe. The second most important thing I want to mention is the mother's comfort. If the mother isn't comfortable while breastfeeding, she won't want to breastfeed. She'll get uncomfortable, her back might hurt, the nipple might hurt. So before you even start, you should position yourself correctly. And what does that mean? It means sitting in a comfortable chair that you feel you can sit in for at least about 15 to 20 minutes, which is probably the duration of each breastfeeding. It may be faster, it may be a little slower. Remember, every baby is different and every mother is different. So Even if your friend is breastfeeding and her baby finishes in 8 minutes, don't be alarmed if it takes your baby 15 minutes to feed. These differences are quite normal. So mother's comfort is very important. You want to sit in a chair where you feel comfortable, again, where you can sit for, let's say, anywhere from 10 to 20 minutes. And you want to have the proper pillows, if you can, to help you get the baby, to bring the baby to the breast. I'll probably say that a couple times because it's the most important thing to always remember, that the baby comes to the mother's breast. Mother does not go to the baby. Why? Because if you go to the baby, you'll be uncomfortable. You may be leaning forward, you may be leaning to the side, your back might hurt, your neck may strain. So again, mother's comfort is priority. So find a good chair, get a good pillow if you can, and then it may take a couple times for you to figure out the position of the breastfeeding that your baby likes. There's a couple of ways you can breastfeed. So the first one I would like to talk about is the football hold, is what we like to call it, or I like to call it. So this is where you're gonna, again, position yourself comfortably, usually with some sort of pillow here, to support the baby. I like to take the arm that's on the outside, and you'll use your elbow to support the baby's weight, and of course support the head and the neck of the newborn baby. And then what you're going to do here is you're going to bring baby to the breast, like this, okay? The other position is across the body. This time the pillow should be on your lap. And there's two different arm positions. So one of the most important things you need to remember in this position is bring the baby's belly to your belly. So you can hold the baby with two arms, again, a pillow underneath you. Use your hand here and support your baby here, belly to the belly, and then you'd latch the baby on like this. So again, baby comes to the breast. In this position, you can also try one arm. Again, a pillow would be here. This time you would use your opposite arm and hold the baby's body with your elbow here and head and neck here with your hand. And again, stomach to stomach, bring the baby to the breast in this way. So those are a few of the positions that you can try. And again, just remembering whatever's most comfortable for you and whatever's most comfortable for your babies. Sometimes you'll notice different children that you have will prefer different positions, and that's okay. And then in terms of breastfeeding, in the initial period after your baby is born, babies should eat as often as they like. Usually a baby will eat every 2 to 3 hours, but I always like to tell new mothers that when the baby's hungry, feed the baby. In the first week after a baby's born, they often lose weight. This is normal. By 2 weeks, the baby should have regained the birth weight. So after you see your doctor after 2 weeks, if the baby has regained the birth weight, then you're feeding enough and the baby's getting enough and you don't have to worry. If the baby hasn't regained weight, you just need to be more vigilant and feed more often to get the baby's weight up. There are a couple important things to talk about for breast milk right after you give birth. One of the things is that your body doesn't have milk right away. It takes, for some women, 24, 48, even up to 3 days to get milk in the breast. So some women don't understand that because we don't tell them. So it's important to know that you might not have milk right away, and that's perfectly normal. So I say that to encourage you to continue to try to breastfeed, even if initially you don't feel like you have enough milk. What your baby is getting is something called colostrum, and it's a very nutritious source of food for them in the beginning while your milk is coming in. So again, after you have the baby, you can start breastfeeding right away and then feeding on demand. On demand means when your baby starts to fuss or cry or any sort of motion that looks like they want to feed. They'll do things like, they may lick their lips like this, or they may start to suck and do a nippling sort of. Those are all cues to the mother that says that they're hungry. Usually by the time the baby's crying, it means they're past that point. They're already very hungry. So pay attention to what they do. If they wake up, start looking around, start moving their head, making sucking noises, that's them telling you, hey mom, I'm ready to eat. So pay attention to those cues and you'll be fine. Again, it may take your baby 5 minutes to eat. It may take him or her 15 minutes, and that's okay. It's good to alternate breasts at each feeding. You can either do both at once if you prefer, or you can alternate once your milk has come in for each feeding. It depends what's the most comfortable for you. Some women find that the breast milk sensation, it's a full sensation, it can be a little bit uncomfortable, so they prefer to breastfeed on each breast at each feeding. Again, that's an individual and totally up to you decision to make. But the most important thing is to feed your baby on demand. And your schedule of feeding may be different, again, from another mother's, and that's totally fine. As long as your baby's gaining weight, then usually your baby and you are doing great with breastfeeding. So another thing that's important to mention, since you'll be breastfeeding, is what does the poop of your baby look like while they're breastfeeding? So breastfed babies often have a yellow colored poop, which is totally normal, and it often has little seed-like quality to it. So it's yellow with sort of a mustard seed appearance, and this is again very normal. So your baby will be pooping a different color. Oftentimes solid stool won't develop for a few months until your baby starts eating other foods when they're older. So again, yellow mustard seed like poop is again completely normal, and you don't have to worry about that. So milk production, what's normal for a woman? So the number one thing is if you're a breastfeeding mother, you need to get a lot of hydration, meaning plenty of water, because your body needs that fluid in order to produce enough milk. So hydration is one thing that's very, very important, even more when it's a hot day and you're sweating more. So you need to be very aware of how much water you're drinking. The other thing that's important about milk production in a mother is that the more that your baby stimulates your breast by breastfeeding, then the more the hormones in your body will tell your body to keep producing milk. So if you can feed your baby every 2 to 3 hours, what it does is it tells your body to keep producing milk. If you start to go many hours without breastfeeding, it tells your body to slow down on the production. So as you're still breastfeeding exclusively, continue to stimulate the breast and your body will catch up and keep producing a lot of milk. Later on, when you're starting to wean, say after 6-8 months if you can, then longer periods without breastfeeding will help your body settle down and not produce as much milk when your baby doesn't need it as much.